Hey, everybody. Hope you're having a good Wednesday. I am just stopping by at the end of a great day of clinic to talk with you all about a common topic that we review with people in clinic, which is vitamins. So, we're going to start doing a series on Wednesdays, kind of a did you know, FYI, would you believe topics that we think are important for our post-operative patients and some different factoids. Hi, nice to see you. Good to see you too. Um, and this is a way to interact. You guys can throw questions in on Facebook. I can see those happening in pretty close to real time. And I just want to talk for a few minutes. So tonight our topic is going to be bariatric vitamins. Also, if you want to send a little comment about would you rather do this around noontime? Do you like doing this in the evening around 5 or 6? I just want to reach as many people as possible so that we can get these topics out and in the open. So tonight we're going to talk about vitamins. We talk about vitamins at every post-operative visit, and that's because we are changing the way the stomach works. We're changing the way the stomach absorbs nutrients, and we're also changing the amount of nutrients that people are putting in. And so it's really important that we are getting the proper vitamins so that you can have a good, long, healthy post-operative life. So there are tons and tons of vitamin options out there on the market. They can be really overwhelming, and we want to make sure that you have good quality options. So one of the things that we offer through our office are a couple of vitamin brands that we know are really good, and that's Bariatric Fusion and Bariatric Advantage. Both of those are formulated to break down and absorb better for someone who's had weight loss surgery in the past, and they're also formulated with the amount of nutrients someone needs. So I wanted to highlight a couple of things. For example, there are some people who just want to take a chewable Flintstone or a Centrum one a day. So if we think about one of the really common things that we need to include in our vitamin regimen, let's think about B1. So that's thiamine, okay? And thiamine helps us with all sorts of neurologic processes. When it gets low, people can stumble around, they can have confusion, and that can be temporary, or in severe cases, it can be permanent. So when someone's had sleeve or even a duodenal switch, we recommend 12 to 50 milligrams a day, and that's from the National Society guidelines. So when we look at our bariatric vitamins, they have between 12 and 36 a day. But if we look at something like a Flintstone has 1.5 milligrams of thiamine, and a Centrum has 1.5 milligrams of thiamine. So if you're not getting enough in your diet, you're definitely not going to get enough extra in your vitamins. And that's one simple, straightforward example. When we talk about vitamin A in our duodenal switch patients, so those fat soluble vitamins that are harder to absorb, we recommend for duodenal switch patients 10,000 units of vitamin A a day, and that's the guideline for sleeve and bypass is between 5,000 and 10,000 also. Um, so our Bariatric Advantage, Bariatric Fusion are right there. Flintstones 3,000, Centrum 1,500. And so, hi Teresa, it's good to see you. I really like when people tell me they're watching because I feel like I'm talking to myself in my computer sometimes. Um, so the vitamin A, we're going to get a third or a sixth of the amount necessary if we're using a standard over-the-counter vitamin. Now, technically, bariatric vitamins are also over-the-counter. You don't need a prescription for them, but we do sell them in our office so that you can narrow down those choices. And we also have a link through our website so you can narrow down those choices. So hopefully that will help. Hi, Karen. Good to see you. Um, Other things that we can look at, like Vitamin B12. People ask all the time, "Oh, I need more B12 because I don't have enough energy." So, post-surgery, we recommend 350 to 500 micrograms a day. Bariatric vitamins actually have 500 or more. Flintstones have 6. That's just a 6, and the same for Centrum. So again, those numbers are really low. So for some of those other things, we're going to end up needing lots and lots of other vitamins. And I think that for people that are going to be taking these supplements long term, it's a lot easier to take one pill in the morning when you wake up. Um, if you've met with me for a post op appointment, or if you're one of my pre op or post op patients, I've probably told you to put your vitamins next to something you do every day. So whether that's brush your teeth, put on your deodorant, maybe you do both, then putting those vitamins right there where you grab it and make it part of a daily habit like those other things. Hi, Priscilla Curry. Nice to see you. And then developing that habit, it takes time. Some people need to set a timer in their phone. Okay, let's talk about another vitamin that's really important, which is calcium. Calcium is important for our bones. Calcium is harder to absorb after weight loss surgery, and it is also harder to absorb if you're taking iron at the same time. So, for a lot of our patients, they are taking a post op bariatric multivitamin that has iron and the multivitamins mixed together, which is awesome because that's one less pill you have to take, right? One less thing to remember. But if you take that multivitamin with iron, you can't take calcium at the same time because calcium and iron get absorbed through the same channel. So you can only get one in, and iron usually wins out. All right, we got some feedback. Erica sets a timer. I think that's a great way to remember to take those vitamins. So calcium gets absorbed separately from iron so that you actually get it into your body. And you need more calcium because you're still not going to absorb all of it. So we have to give it in kind of divided doses. So for women who are still having regular menstrual cycles, we recommend a multivitamin with iron, and they need 2 calciums a day. For women who are past menopause, higher risk of osteoporosis, they need 3 calciums per day. So the easiest way to take your calcium is to follow a meal. The calcium citrate that we recommend in the chewable versions can be taken with food. Um, there are sweeter versions. Some people say that that kind of quells their sweet tooth, and some people like the chocolatey versions. Some people use the chewable caplet kind of tablets that are more like a orangey flavor. So there's lots of different options, and we can help guide you through that when you come to see us for post-op appointments. All of these vitamins are really important long term. And the further you get out from weight loss surgery, the more potential time you have to develop a vitamin deficiency. The only way we can definitively know if you have a vitamin deficiency is by checking your vitamin levels. So we routinely check those at 6 months post-op to see how things are going. And then at your 1 year post-op, your surgiversary, if you will. And then we check them yearly after that, or more often if needed, or if we're repleting or adding back something that's gotten low. So I did not go through every single vitamin recommendation. Um, but the key is a good vitamin can help you have good success with that tool of surgery, help you be healthy, and make sure you're getting all of those micronutrients, vitamins, and minerals so that your body can do all of its normal daily processes. So I hope that was a good 9.5 minute intro into vitamin supplements. If you have questions, you can always call the office, throw questions, and I will check our Facebook here in a little bit and see what people have come up with. Um, Feel free to come back and watch this and review it. If you feel like maybe your vitamins aren't in normal range and you haven't seen us in a while, we need to see you. We want to make sure you're doing well. And these are things that we check like I said, on a routine basis to make sure we aren't seeing any deficiencies develop. Always easier to deal with and easier to get back up to speed when we're starting with just minimal concern. So again, I hope you guys are all having a great day. It's nice to see you all, and have a great evening. Enjoy that the sun does not go down at 5 o'clock, and I will talk to you all soon. We're going to do these did you know factoids, would you believe, etc. We're going to do these on Wednesdays for a few weeks. Let me know in the comments if you think that Wednesday evening, like 5 o'clock, 6 o'clock is better, or if you'd rather do like a little lunch and learn 10-minute talk, and that would be good. Hi, Damika. Good to see you. Okay, everybody, have a great night. Talk to you soon. Bye.